In this video, we will be discussing about the compartments of the leg. In the leg, we have three compartments: anterior compartment, then we have lateral compartment, and posterior compartment. And posterior compartment is further divided into deep compartment and superficial compartment. So, what all we have in the anterior compartment? In the anterior compartment, we have muscles like tibialis anterior, extensor digitorum longus, and extensor hallucis longus and peroneus tertius. These four muscles are there in the anterior compartment. And what is the nerve and the vessel in the anterior compartment? We have the deep peroneal nerve and the anterior tibial vessels. Then we have the lateral compartment. Lateral compartment is in relation to the fibula and it contains which muscles? Peroneus longus and brevis. And they are supplied by the superficial peroneal nerve and superficial peroneal fibular vessels. Okay, separate vessels are there. Then in the deep compartment, posterior deep compartment, we have tibialis posterior and flexor muscles. Like here were extensor muscles, extensor digitorum and extensor hallucis. Here we have flexor hallucis and flexor digitorum. And the another muscle is popliteus. And what is the nerve supply? Nerve and the vessels. Nerve is tibial nerve and the vessels are the posterior tibial vessels. Then we have superficial compartment. Superficial posterior compartment contains muscle like gastrocnemius soleus and gastrocnemius and plantaris. And it does not have its separate nerve or vessel supply. It is supplied from the branches of the deep posterior compartment. So, what is the main takeaway? That all the three compartments have their separate blood supply. Out of the four, if we consider superficial and deep separate, out of the four compartments, three have separate blood and nerve supply. But the fourth one, that is superficial posterior compartment, does not have its own vessels and nerves. So, what are the vessels? Again, we are revising. And the anterior compartment, we had the tibial vessels, anterior tibial vessels, and deep peroneal nerve. In the lateral compartment, superficial peroneal nerve and fibular vessels. And in the deep posterior, we have the tibial nerve and the posterior tibial vessels. In the superficial posterior, there are no vessels. So that we need to remember about the compartments of the leg.